So hello everyone, this is Dr. Jay Mehta here, and this is going to be a session which is going to be a live session for all the family physicians across the country, across India, where we are going to try and explain about very simple things like the practical usages of oral contraceptive pills on a day-to-day basis. Like how can family physicians use oral contraceptive pills in their daily practice? If you look at our previous two sessions have tried to explain what is the pathological mechanisms where OCPs can be used, what is the pharmacology of the oral contraceptive pills, and what are the different type of combinations and side effects, which you need to keep in mind as far as oral contraceptive pills are concerned. In this session, I'm going to make it very, very practical, and I'm going to try and put up very simple indications and usages which as family physicians you can remember in your daily practice. In order to do that, I'm going to start off with the screen sharing, as you all always know, and I'm going to try and draw certain things for everyone so that you will almost always remember the different indications and then what are the common OCPs which you can use in these situations. So here we go. Let me just start the screen sharing here. Okay, so on my screen sharing option, all of you can see that I have written OCPs, that is oral contraceptive pills. And after writing OCPs, oral contraceptive pills, I'm going to try and list out certain important indications which you all must try and follow. So the first thing is basic contraception. Okay. The second indication for routine family physicians is in managing irregular cycles. And the third common indications is menorrhagia. These are things which are extremely common. Okay, so a lot of family physicians bank their practice on using these things. And the fourth is postponement of menses. So these are the four common indications for which OCPs can be used by family physicians. Along with menorrhagia, also let me include dysmenorrhea in this chapter because dysmenorrhea is typically painful menses. So as we all know, oral contraceptive pills have two components. One is ethinyl estradiol and the second component is going to be a progesterone. These are the two components which are going to be present in every oral contraceptive pill, which is a combination pill. Now, these pills can typically be begun from the first day of menses and they are given till 21 days of menses. This is the best method of giving it. You need not wait till the 5th day of the menstrual cycle in order to initiate the oral contraceptive pills. They can be initiated right from the first day of menstruation. Okay. Also, one must remember that typically the pills which are available are going to contain 30 micrograms of ethinyl estradiol. There is only one pill which is by the name Overall G, okay, which is going to contain a high dose of ethinyl estradiol. The progesterone combinations are almost going to be the same. So let me just write 4th generation progesterone out here, okay? And there are also something called as low dose OCPs, which contain 20 microgram of ethinyl estradiol. I'm writing all these three things here so that you understand what is the practical importance of these dosages. Why do you need to understand 30, 50, and 20? So let's start. Okay. Let's say somebody is looking only for contraception. That means the lady is otherwise having regular menses. The sole purpose for her taking oral contraceptive pill is for her contraceptive usage. The most recommended pills for contraceptives are going to be those pills which are low dose. So these are the pills which contain 20 micrograms of ethinyl estradiol. These pills, as I said, need to be started from the first day till the 21st day of menses and preferably to be taken at the same time of the day. Okay, so let's say if everyone is taking the pill at 9 o'clock in the night, give them a window that you can take the pill between 8 o'clock and 10 o'clock, but they should not skip the pill for more than 4 hours. if they do that, they can experience something called as withdrawal symptoms. Okay, that means they can have abnormal bleeding or untimely bleeding, and it can also lead to contraceptive failure, especially if it happens within the day 1 to day 9. Okay, that can lead to a contraceptive failure as well. So as a result of this, taking these pills on the same time, or preferably in that same time window, is going to be extremely important. But this is basically contraception. So this is going to contain pills like Femilon. Okay, this is something which is a very commonly available pill, okay, by the name Feminon. The other commonly available pill for this is something called as Yaz. Okay, that also has 20 micrograms of ethinyl estradiol. As far as irregular cycles are concerned, you must remember that for a lady who is having irregular cycles, one of the most common things which a family physician is going to look at is going to be PCOS, that is polycystic ovarian syndrome. And in polycystic ovarian syndrome, one thing which is important is that your progesterone should be a 4th generation progesterone. Okay, why am I saying of 4th generation progesterone is because quite a lot of times people are worried that PCOS patients are obese and OCPs can cause weight gain. But remember, 4th generation progesterone has no effect on weight gain. In fact, some of them can cause a weight loss as well. Okay, the commonest available tablet in 4th generation is going to be a combination of drosperinone. Okay, drosperinone and ethinyl estradiol. Okay, this ethinyl estradiol with a combination of 30 along with drosperinone forms your 4th generation OCP. Okay, and these are very commonly used in PCOS, and they need to be prescribed for a minimum of 9 cycles to start off with. The only exception to this entire rule is when your patient, along with all this, is also having something called as hirsutism. Okay, that means when they have hyperandrogenism along with PCOS, okay, and hirsutism as a character, then you should use something which is having ethinyl estradiol. Okay, and along with that, it has an anti-androgen. So that anti-androgen is cypoterone. Okay, now this is normally available as something called as Diane 35 or Crimson 35. These are your commonly available OCPs for that purpose. But remember, even if somebody is with hirsutism, this pill needs to be taken minimum for 9 to 12 cycles. Okay, do not say that you are going to give it for 2 cycles and you are going to get benefit out of it. In all other cases of irregular cycles and irregular menses, as I said, you can alter between 3 to 6 cycles, but for PCOS, 9 cycles is a bare minimum, and drosperinone is our most commonly indicated 4th generation oral contraceptive pill. Okay, when I talk of menorrhagia and dysmenorrhea, all right, remember that thing. Whenever somebody has heavy bleeding, your predominant action is going to be on the uterus. Okay, in contraception, you predominantly act on the ovary. In irregular cycles, you go and predominantly try and act on the ovary. You try and control the hypothalamo-pituitary ovarian axis. But in heavy bleeding, you are countering the different mechanism. You are going and acting on the uterus. Okay, so now what happens and how do you control this thing? So let me give you a very simple guideline. Okay, what does an oral contraceptive pill do? Because of sustained oral contraceptive pill for 21 days, it causes atrophy of endometrium. Okay, so it causes atrophy of endometrium, and which causes reduction of bleeding, which causes reduced flow from next cycle, and that is important. Okay, and that is the mechanism of action of using OCPs in heavy bleeding. The same mechanism, because the bleeding has gone down, all right, because the bleeding has gone down, the pain during menses has also gone down, and that helps in controlling your menorrhagia as well as in controlling dysmenorrhea. The only thing which is important, which you should remember in this situation, that it is not mandatory to give a 4th generation pill. This is not mandatory. 4th generation pill for menorrhagia is not mandatory. Commonly prescribed pills for menorrhagia are going to be overall L, are going to be Novelon, All these are containing 30 micrograms of ethinyl estradiol. Okay. One combination which you should remember, which is a new combination, which contains ethinyl estradiol along with a molecule called as dinogest. And that is something which is prescribed in patients who are having endometriosis. Okay. This is just an add-on point, which as family physicians, you must remember, though you are not going to get a frequent opportunity of prescribing this, okay, because this is going to be the work of a super specialist, but this is just something that you should remember. Okay. Lastly, I also want to tell you is that quite a lot of times when a patient is having heavy bleeding, okay, that time look at the endometrial thickness. If the endometrial thickness is less than 5 millimeter, okay, if the endometrial thickness is less than 5 millimeter, remember, giving only progesterones in the form of regesterone or something for immediate use is not going to work, because for regesterone to work, regesterone requires an endometrium which is primed with estrogen. So that means the endometrial thickness should be more than 5 millimeters. In these situations, you can use oral contraceptive pills which are having 50 micrograms of ethinyl estradiol, and that is going to be overall G. Otherwise, 50 micrograms is a very heavy dose. So remember, we do not like people using ethinyl estradiol at 50 micrograms very frequently. Okay. And lastly, something which family physicians will commonly see is going to be postponement of menses. Okay. So whenever you are talking of postponement of menses, I have always given you as a thumb rule, when you want to postpone menses, always look at the uterus, look at the endometrial thickness. If the endometrial thickness is more than 6 millimeter, the safest thing is to give meprate or medroxyprogesterone acetate. If it is less than 6 millimeter, which is going to happen in the early half of the cycle, okay, this is usually in the late half of the cycle, this is going to happen in the early part of the cycle, then you should give OCPs for 3 weeks. OCPs for 3 weeks can give a beautiful postponement of menses if the patient has presented you in the early half of the menstrual cycle. All right. Now remember one thing, this entire one page no is going to be extremely important information for family physicians who are planning to practice with a lot of sincerity and dedication as far as their individual private practice is concerned. You must by heart this one page. Okay. And you must remember that whenever you are prescribing these oral contraceptive pills, do not blindly follow this page. Do not blindly follow. This is simply for your reference. This is for your reference so that you understand that in common situations, what are you supposed to write and how are you supposed to counsel your patients. Do not say that because this was told, this is the OCP which I'm going to prescribe. A lot of different molecules and brand names are available. Please remember the indications, the relative contraindications, and the absolute contraindications of using OCPs before you prescribe it to any patient in your family physician practice. I hope this short 15-minute lecture has given you a lot of purpose and insight about prescribing oral contraceptive pills in your practice. I hope to see you on next Monday with our routine topics. This is going to be a different topic on next Monday. It is going to be a topic which we are going to start off on gynec cancer. So I think that's going to be a very good topic for all family physicians. So thank you very much for joining in today.